If you look at the research from the National Osteoporosis Foundation, we know that about 700,000 patients per year have compression fractures or fragility fractures of the spine. In talking to my colleagues, I realized that all of us really weren't as aware as we should be about the silent epidemic of this disease and how many people are affected. Most of the time when a patient develops a compression fracture, it presents itself in a pretty big way. It's fairly obvious that I am hurting right now. Because of the osteoporosis, a person can just sit down and present with the compression fracture. Or one patient of mine states that she was just reaching to grab an item and she felt this pain in her back, which was excruciating. Oftentimes the patient will go from the acute care setting and have back pain, and they'll be misdiagnosed or underdiagnosed. And patients oftentimes are treated, especially the older patients, here's some form of pain medication or pain management, and it's just you're getting older, it could be arthritis. They'll still be prescribed physical therapy. Physical therapy helps to strengthen the muscle, but does nothing for the bone. So when a person has a compression fracture that's painful, you're basically torturing that person. You're not helping them at all. If you carry a diagnosis of osteoporosis or osteopenia, your first thought should be, I have a compression fracture. When you have back pain, or you have back pain plus pain that will radiate around your sides into one rib or the other. When we don't make the diagnosis of compression fracture and you have one that's active, you're 5 times more likely of having another fracture within the first year. If a person has several of these fractures in the upper spine, their breathing changes. They develop pneumonia, and ultimately that pneumonia causes death. It's important that it incumbent upon us in the medical community in particular that we are aggressive at making the diagnosis and treating these patients when appropriate.